How many days of treatment is this today?
Today is number 3.
Okay, so Sunday has graciously agreed to video document this. And Sunday, go ahead and zoom in on Sunday's arm. We are doing today the frequency-specific microcurrent. So I just want to start talking about that. So Sunday has RSD in her right arm. You can see the one right here. We marked, what I did is I came down, as you know with RSD, light touch is excruciating. So we came down and I asked her wherever it started hurting to let me know. And then we literally marked it with a Sharpie, and you can't see the other part, but it's like she's wearing a glove all around. And then on her right hand, these 3 fingers, pretty much the whole finger, right, were numb. How long has it been like this?
Probably about 3 years.
3 years, okay. Does the pain here ever go away?
No.
Okay. And so up until today, we started with our first technique, working on the upper cervical spine, and Sana, you responded great right away, right?
Right away, yeah.
Okay. So you told me that your pain never ever went below a 5, is that correct? Okay, and how low did your pain go the first day?
204.
Okay, we started at 7 the first day, right? Okay, and then the second day you went down yesterday to a 3, right? Okay, and where is your pain out of 5 right now?
Probably about a 4.
About a 4, okay. Now here's the amazing thing. This is where the pain started. More if you would zoom in. And then we started treating with the frequency-specific microcurrent. We're treating the original injury. She had a car accident. And so we're treating neuropathic pain of the spinal cord first. And so that's what we're treating right now. And let's just see how far down your pain is now. Let me know when I reach it.
About right there.
Oh, right here. Okay, so let me know where.
About right there.
Okay, so I'm guessing we can draw a ring all the way around your arm. So I would say about 1/3 of it is gone right now. Okay, we'll test back. We'll check back in a little bit. Oh, your numb fingers on your right hand.
Right. I have to have tingling in my fingers now, and I haven't had anything in years. No feeling whatsoever. Not tingling. Not anything.
Is it still tingling? Does that feel weird?
It feels like they're, when they've been asleep, it's tingling a little bit.
Awesome. I'm so excited.
Me too.
Okay, we'll check in again in a little bit. So we're just checking back in with the frequency-specific microcurrent we're doing today. So Sunday's RSD started in her right hand, correct? Started with your fingers, the numb ones. Were they numb right away?
They started being like numb off and on. They would get numb and then they wouldn't, and that's when I started noticing I was having trouble with grip and things in my right hand.
How soon after your accident?
Probably a few months. Like I said, I was having stabbing pains in the back of my head at the same time I started losing feeling in my hand and in my fingers.
All sort of at the same time.
Okay. And then it gradually progressed up my arm and started.
So it went into the hand and then it crept up the arm. Alright, so it's interesting with this, we're reversing this. So it started going down at the top of the arm. You can see the marks here, Marla, if you zoom in. At a point here, we were moving down about 1 inch a minute. And right now, where's the pain?
Just right there at the base of my wrist.
At the base of your wrist. Okay, so we're going to leave it there for a while. And again, what we're treating right now is what I believe in Sunday's case, and what's often the case in RSD, is the original injury. And to me, patients always say, so what's the difference between your treatment and, let's say, the ketamine treatments, or some other kind of treatments?
I've done epidurals where, they try to completely just numb your right arm, or nerve blocks, injections in the back of my head. Some patients, they last 3 to 4 weeks. Me, the first one I had in the back of my head lasted for 3 days, and then it come back with ridiculous rebound. And the second time I had rebound pain immediately. It didn't ever numb. But in 3 years, I've had 3 days of relief.
Wow, and those were good days.
Mm-hmm.
Temporary. Well, the problem is with those treatments is you're trying to numb the nerve, scramble the nerve, confuse the nervous system, block the nervous system to stop the pain. But that is not sustainable. Plus, you're not getting to the true cause of the RSD. So what we're treating right now is the neuropathic injury to the spinal cord itself, because it all starts with the central nervous system. You cannot see this towel, but we've got electrodes around her neck and her hands, and again, this is frequency specific microcurrent. It is not a TENS unit. If a TENS unit could cure RSD, you guys would have had no issues.
We would have all owned one already.
Yeah, TENS units are not that hard to find. Where's your pain right now?
About a 3.
About a 3 out of 10. Okay, you can stop right there. Alright, so we are finishing her first day of the frequency specific microcurrent, and this is where we originally started with the RSD. It started in her hand, moved up, and now you can see I can lightly touch that. How does that feel?
Does that hurt?
Is that crazy?
Very crazy.
You've got tingling in your fingers.
Mm-hmm.
Move your hand for me. Alright, so now we're going to go ahead and finish up today. And we probably won't get this part on video, but we're going to get some scarring of the nerves. We're going to treat some portions of the brain that have been affected. And we'll check back in tomorrow, but we're going to go ahead and post this today. And did you have anything else you wanted to say?
It's awesome. It's awkward. It's weird. Just my joints are sore, but everything else is not.
And because your brain for so long, I equate it to music. If you have one song that's really, really loud, you're not going to hear water flowing. So normally for me right now, my brain knows where my arm and my hand is, and it's like water flowing. It's a soft thing, it's in the background. Then you have loud heavy metal music, which is the RSD, the pain for so long, and that's how your brain knew where your arm was.
Mm-hmm.
So right now, because that music is gone, your brain has to learn to listen for the sound of water again. Does that make sense?
Yeah.
More subtle nerve input. So your brain literally has to learn again where the arm is in space, and that will take a few days for that to really kick in. So let's get to work and finish.